My name is Kevin Colopy. I'm the Clinical Outcomes Manager for Airlink and Vitalink Critical Care Transport. It's Kevin, K-E-V-I-N, Colopy, C-O-L-L-O-P-Y. I've got cards for you guys too.
Okay. All right.
So can you tell us a little bit about what's going on here today?
So we're here today to talk about the need for emergency donation of blood. Every Airlink helicopter carries a unit of O negative and a unit of fresh liquid plasma on board, because when patients experience severe hemorrhage, whether it's in a car accident or other traumatic injury or from a medical source of bleeding, the definitive care for those patients is to emergently administer those patients blood products. Blood products carry both factors that allow us to clot faster to stop the bleeding, as well as carry red blood cells, which allows us to deliver oxygen to our patients. And right now there is a shortage of the reserve of blood throughout North Carolina as a result of all the winter storms. Normally we try to have a 5 to 7 day supply of blood within the region, and it's starting to get down towards about 3 days of blood.
For those of us, which is most of us, who have not been inside of an Airlink helicopter and thankfully or hopefully will not be, what is that situation like? Probably similar to that of an ambulance. I mean, that's a high tension situation. Just sort of describe, what it's like when you're responding to calls.
So inside of every Airlink helicopter is a critical care transport nurse and a critical care transport paramedic. Both of those staff have several years of experience before they become employees of or members of our team. And when they are responding to incidents, they are asked to respond to patients experiencing time-sensitive emergencies. So by that very nature, they're going to receive the sickest patients, the most seriously injured patients. So they have to be expected at any given day to respond to a variety of incidents. It is a high-stress environment where safety is always of the utmost importance, where they're always putting their safety first and then doing whatever they can to provide whatever critical intervention the patient might need. Part of being able to provide those critical interventions is bringing life-saving blood to the bedside of the patients so that it can be administered faster rather than having to wait for them to arrive at a hospital.
What area do these helicopters cover?
So New Hanover's 3 Airlink helicopters are able to respond as far north as Jones County into Duplin County. Right here where we're sitting at Albert Ellis Airport, it's a 5-minute flight into Duplin County. We respond into Sampson County. Our Airlink 2 helicopter will respond as far west as Scotland County, Robeson County, and then our 3rd helicopter is in Brunswick County. So we're able to essentially respond anywhere 150 miles south of New Hanover County and south of the North Carolina state line. We can fly directly from Wilmington all the way west to Charlotte, but primarily we responded anywhere in the 7 counties in southeastern North Carolina.
Why are what situations what kind of an emergency has to be going on where an ambulance can't be used, and this is the mode of transportation?
So it's not an incident where an ambulance can't be used. It's an incident where a patient is experiencing a time-sensitive emergency where the helicopter either provides one of 2 things: faster access to a hospital that can provide a critical intervention for the patient, such as in a heart attack when they need to go to the cardiac catheterization lab, or a motor vehicle accident where they have severe internal hemorrhage and they need a trauma surgeon to operate on them. In other instances, that critical intervention is something that the aircraft is able to bring directly to the patient faster than if the ambulance were able to drive to a hospital to try to get that same intervention. So we're either bringing a time-sensitive intervention to the patient or delivering them quickly to a hospital providing that time-sensitive intervention.
And as you mentioned now, what is it? They're required to carry 2 units of... Is that a new thing?
Yeah, I was going to ask you about the plasma. If
Yeah,
you could give an example of when...
Here? What's new?
So can you talk to why you carry 2 units of life-saving, and also how recently you started carrying them?
Sure. So for years in out-of-hospital care, the standard practice when someone has had severe hemorrhage has been to give them normal saline, which is water with salt in it that's balanced to be the same concentration of salt in our body. What we have learned through multiple clinical trials is giving patients lots of saline or water doesn't help their outcomes. They don't necessarily do better when they're suffering blood loss, because while we restore volume to the patient, we aren't giving them clotting factors and we're not giving them oxygen carrying capacity. By carrying blood and plasma, we are able to deliver both of those to the patients. Last summer, a clinical trial came out that looked at multiple sites across the country and discovered that yes, it's really important to give patients packed red blood cells, which is oxygen carrying capacity, but they actually do better if they get liquid plasma, which also has the clotting factors in it, before they get those blood cells. So we started carrying this fall both plasma and red blood cells. We've been carrying red blood cells for about 18 months now, so that we're able to provide both those critical interventions the patient needs, clotting factors as well as oxygen carrying capacity.
Have you had to change any of your training to be able to administer that blood when you're en route, or are you guys pretty much equipped to be able to do that?
Airlink teams have always been trained to transfer and initiate blood on patients. We did provide an additional several hours of training to our staff so that they can properly handle and store the blood so that it's always safe to administer to the patients.
And then part of why we're doing the interview now is that we were originally going to do